Hello, it is now 2 p.m. Eastern Time. You've joined the 2023 Justice and Mental Health Collaboration Program, New Grantee Orientation Webinar, Part 1. We're going to wait a couple of minutes to give other grantee sites an opportunity to sign on. So we'll start at about 2 past the hour. Thanks.
Oh.
Good afternoon. Thank you for joining today's webinar. We are here with the 2023 Justice and Mental Health Collaboration Program and Connect and Protect new grantees. This is the first of a two-part series for our orientation webinars for you all. We're going to talk a little bit about the JMHCP and Connect and Protect grant programs and give a training and technical assistance overview. So thanks so much to everyone for joining us today. To give you a little bit of an overview of today's webinar, first, we're going to do some welcome and introductions, give some background on the Department of Justice and the Council of State Governments Justice Center. We're going to provide an overview of some behavioral health information and diversion information. There will be an overview of the Justice and Mental Health Collaboration Program, or JMHCP, and Connect and Protect. We'll have time for question and answers, and then we're going to do a breakout group. So half of you are here because you received an award under what was called JMHCP. The other half received an award, which is part of JMHCP, for Connect and Protect. So we're going to break out at the end to have another shorter discussion on training and technical assistance with each of the teams separately. Just a reminder, anytime if you have questions during today's webinar, you can actually use the chat function. Our colleague Andrea had also posted some information on if you encounter technical or audio issues. We are recording this webinar and it will be posted to the Council of State Governments Justice Center website within 1 to 2 weeks. So I get to introduce my fellow speakers. So first we have Brooke Mount. She's a senior policy advisor for the Bureau of Justice Assistance at the U.S. Department of Justice. Dr. Brooke Mount is a seasoned professional with a wealth of experience in the fields of behavioral health and criminal justice matters. Currently, she holds the position of senior policy advisor within the Justice and Behavioral Health policy teams at the U.S. Department of Justice's Bureau of Justice Assistance. She oversees justice and mental health portfolio, which includes collaborative crisis intervention training, the Justice and Mental Health Collaboration Program, and the Connect and Protect Law Enforcement Behavioral Health Response Program. She collaborates with national partners to assist states, local governments, behavioral health organizations to better understand the relationship between justice and mental health populations and create policies that meet the needs of municipalities and serve citizens. Dr. Mount is a recognized subject matter expert who holds licensure as a professional counselor in the District of Columbia. Before joining BJA, she dedicated her career through the court services and offer of supervision agency and as a clinical director of a private practice as well. Additionally, we have Ernest Stevens, who we call Ernie. He's a Deputy Division Director of Behavioral Health at the Council of State Governments Justice Center. He oversees the portfolio on improving outcomes for people with behavioral health conditions and homelessness who encounter law enforcement. Previously, Ernie served over 28 years in law enforcement, helping to develop new programs and policies for the San Antonio Police Department. He served as a program manager for the Southwest Texas Regional Advisory Council that oversaw the emergency operation for 22 counties in Texas. And he's also featured in the Emmy award-winning documentary Ernie and Joe Crisis Cop. So if you think maybe you had heard him before or seen him before, it could be through that amazing documentary. We also have Allison Upton, who's a Deputy Program Director. She oversees the JMHCP grant program training and technical assistance. Prior to joining the CSG Justice Center, she worked at the Center for Alternative Sentencing and Employment, or CASES, as the Director of Court Diversion Programs, where she oversaw operations of several alternative to incarceration programs within New York County. And I'm Sarah Wurzberg. I'm a Deputy Division Director for Behavioral Health at the CSG Justice Center. I oversee training and technical assistance, which includes JMHCP, as well as Second Chance Act Behavioral Health and Housing. And I also oversee our community responder work, which is expanding first responses to people who are in crisis. Now I'm going to turn it over to Dr. Mount to talk a little bit about Department of Justice.
Thank you, Sarah. First of all, hello and welcome, everyone. As Sarah mentioned, I'm a Senior Policy Advisor within the Policy Office at the U.S. Department of Justice's Bureau of Justice Assistance, or BJA. Also within BJA is the Programs Office, and the Programs Office manages the individual awards that each of you have received. And as such, you have been assigned a grant manager who will be your contact within BJA, who can answer all of your questions pertaining to allowable costs, management of the award, and reporting. You will hear from the State Policy Advisor in the Programs Office and learn much more about their work in the second orientation webinar, which takes place next Wednesday. We work closely together to ensure that all this JMHCP and Connect and Protect grantees remain on track with their awards. So we have to open this orientation by recognizing and acknowledging your accomplishment. You have succeeded in securing grant funding in a very competitive year. Your applications were screened for basic minimum requirements, were reviewed, rated, and scored by panels of external peer reviewers. And after an internal review by BJA staff, you were recommended to the Assistant Attorney General for funding. So congratulations on your award. Now I want to talk a little bit about our expectations of you. Since each program was reviewed and selected based on criteria that uniquely qualified you as most competitive, I want to lay out some very basic expectations that we have of you. So what we expect you to think about how your systems can be more responsive to people with mental health conditions and co-occurring mental health substance use disorders in the justice system. We expect that you will take on the planning processes in all of the grants with gusto and be excited to work with your TA coach on this. We are making a difference through this work. You will use a validated screening and assessment instrument for mental health conditions, substance use disorders, and criminogenic risk factors. We expect that you seek appropriate services and identify system gaps for people serving with behavioral health conditions. We also expect that you'll seek help when help is needed and communicate regularly with your technical assistant coaches as well as BJA staff. You will have, as I mentioned, a state policy advisor from our programs office who will help you with budget and grants management, and I will help on the policy side. What you can expect from us is that we will support and assist you as you set out to reach the goals to enhance your systems and reach your program goals individually. We want you and your staff to have the necessary tools to serve this critically underserved population to help your communities. Both the programs office staff and the policy office staff will be responsive to all inquiries when they arise, whether they're technical, about allowable uses of funds, changes in key staff, requesting no-cost extensions, or whether they're regarding critical changes at the state, county, or local level that you foresee potentially impacting your program. You'll also be provided quality technical assistance through the Council of State Governments Justice Center. The CSG Justice Center is the technical assistance provider for JMHCP grantees, as well as Connect and Protect. Each of you will have a TA coach assigned to you by the CSG Justice Center, and we expect them to email you, call you, and challenge you and support you. Overall, considering everything shared so far, what we're trying to achieve is better outcomes for people with behavioral health conditions and co-occurring substance use disorders in the criminal justice systems. So through Connect and Protect, we're looking to enhance law enforcement responses, reduce the prevalence of people with behavioral health conditions in jails, think through how to best address high utilizers of multiple systems, and improve access and connection to community-based behavioral health care. This includes the important work to develop mental health and police collaboration, work towards collaborative county and regional approaches to look at the data to decrease the number of people with mental health conditions in the jails, and to have systems think strategically and plan for diversion of people with behavioral health needs. We're excited for you to work to use data in your systems, develop evaluations, and track performance measurement through the performance measurement tool, or the PMT. We'll talk more about the PMT on the second orientation webinar. Each program has worked really hard to get together an advisory group and put together a great proposal. And we just want to make sure that you can share your outcomes with us and with the field as well. As recipients of this award, you each share a common goal to effectively serve people with mental health conditions and co-occurring substance use disorders in local jurisdictions, and to create positive system-wide change for people with mental health conditions in the justice system, alongside many other professionals across the nation. I just want to talk very briefly about the office in which I work at the Bureau of Justice Assistance. BJA is located within the Office of Justice Programs, or as you may hear it in the future, OJP. OJP provides a wide range of services to the criminal justice community in the form of grants, training, technical assistance, and research. OJP is actually just one of 3 grant-making components of the Department of Justice, along with the Office of Violence Against Women and the Office of Community-Oriented Policing Services. Next slide, please. BJA's mission is to provide leadership and services in grant administration and criminal justice policy development to support state, local, and tribal justice strategies to achieve safer communities. We work with communities, governments, and nonprofit organizations to reduce crime, recidivism, and unnecessary confinement. We also promote a safe and fair criminal justice system. Communities can apply and receive grant funding and training and technical assistance, just like you have, that benefit law enforcement, courts, correctional agencies, treatment providers, reentry practitioners, and community-based partnerships to address the unique challenges in your communities. And it's through the development and implementation of policy services and sound grant management that BJA really works to strengthen the nation's criminal justice system and restore security in our communities. Next slide. So this is our director, Carlton Moore, and he was appointed by President Biden in February of 2022. Director Moore leads BJA's programmatic and policy efforts on providing a wide range of resources, including training and technical assistance to law enforcement, courts, corrections, treatment, reentry, justice information sharing, and community-based partnerships to address chronic and emerging criminal justice challenges nationwide. Next slide, please. These are our 5 major strategic focus areas, and what you see here are the key approaches that BJA takes to accomplish objectives and their strategic focus areas. Many of these strategies are put into action through grant programs, such as the one that you're attending today, And these include a strategic focus on building trust and ensuring effective criminal justice systems, reducing recidivism and unnecessary contact with the criminal justice system. Next slide, please. And these are the types of activities that BJA is engaged in through program policy and national initiatives. We invest diverse funding streams to accomplish goals, educate by researching, developing, and really delivering what works. Ultimately, we aim to equip communities by creating tools and products to build capacity and improve outcomes. And we engage in partnerships by connecting and consulting. So with this brief introduction, I'll turn it over to Hallie to talk a little bit more about CSG Justice Center, the history of JMHCP, and provide critical context about people with behavioral health needs in the criminal justice system. And you'll hear more from me a bit later. Actually, I believe we're going to pass this over to Sarah.
Thanks, Brooke. So just to give you a little bit of information, at the Council of State Governments Justice Center, which people often call the CSG Justice Center or sometimes refer to as CSG, we're a national nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all three branches of government with the expertise of policy and research team focused on assisting others to gain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. So when we describe a bit about how we do this, we have core commitment to being independent and nonpartisan in every aspect of our work, providing vigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and consensus, and being inclusive and respectful of others' views. Next slide. Okay, so now we are gonna give a bit of a history of JMHCP and provide some overview and context for people with behavioral health needs in the justice system. So JMHCP helps states, locals, tribal nations to improve responses to outcomes with people with mental illnesses and co-occurring mental health and substance use disorders who come in contact with the justice system. It supports public safety by facilitating collaboration among criminal justice, juvenile justice, mental health, and substance use disorder treatment systems. JMHCP was reauthorized by the 21st Century Cures Act, including bills the range of initiatives for criminal justice reform. The bill was a milestone in the fight to address mental health condition and co-occurring substance use disorders. And in the past few years, BJA has included Connect and Protect law enforcement behavioral health responses as part of JMHCP through a separate application opportunity. So that is about half of you on this call today. Next slide, please. So there has and continues to be a growing national awareness of the crisis of people with mental health in the United States, and particularly mental health within the justice system. As you all have recognized, it is now widely reported that there are many challenges for law enforcement, jails, courts, and community supervision in addressing people with mental illness and co-occurring substance use disorders. We know for some time that people with mental health conditions are overrepresented in the justice system. One study on the topic found that the rate of serious mental health conditions in the jail was almost 7 times higher than the general population. Of the people with serious mental health conditions in the jail, over 3/4 of them have co-occurring substance use disorder, and it really highlights the importance of the needed for integrated care for mental illness and substance use disorders. Next slide. So this slide really talks about the Department of Justice's Bureau of Justice Statistics data that shows an estimated 33% of state and 46% of federal people incarcerated meet the criteria for a substance use disorder in the last 12 months prior to admission. Among those who met the criteria, an estimated 27% of state and 25% of federal people incarcerated participated in self-help groups or peer counseling. About 12% of state and 15% of federal met the criteria of having a substance use disorder in the 12 months prior to treatment, actually received the treatment within a residential facility or unit during their stay. So another key aspect of this that we hear a lot about and talk a lot about through these programs is really the training piece and the variance of training requirements across states. Here, this is specifically getting at law enforcement officer training for people interacting with mental illness. Some states have mental health training for officers or some specific crisis intervention teams, and some states have both. Only 12 states as of 2018 had this information for the guidelines for crisis intervention teams. So this is really important to consider for Connect and Protect grantees as well as JMHCP partners, and we're thinking about the workforce. Results from a 2018 national survey on drug use and health conducted by SAMHSA, Substance Abuse and Mental Health Service Administration, shows that 1 in 3 adults have a co-occurring serious mental health and substance use disorder did not receive care. So really thinking through some of the gaps that people have in community-based treatment, in addition to the gaps they have with in-facility treatment that we discussed on an earlier slide. People with behavioral health needs have these really complex needs that include mental health, substance use needs, housing, transportation, peer support, case management, addressing criminogenic risk programming, specialized caseloads in some cases. And it's really hard to coordinate across all of these systems. And we're looking forward to, through JMHCP, supporting you all in thinking how best to make all of these connections across the many different systems to meet the needs of the participants in your program. So another piece that each of you will probably have firsthand experience with is that there is treatment capacity that's limited out there in the field. And so there's some gaps in terms of ability to connect community-based services across the country. And even for those with health insurance coverage, access and engaging in mental health treatment services can be a big challenge. So something also that we're thinking about is how to bridge that gap and better get people connected with those treatment options. As we've been discussing, there are a lot of the supports needed for people with behavioral health needs, and the challenges that we really talk about and address through JMHCP and through the grantee training and technical assistance discussions include, providing services across multiple systems, lack of integrated treatment for mental health, substance use disorder, physical health, including intellectual developmental disabilities and traumatic brain injury, coordination with additional systems such as housing and other key recovery support services. And in addition to dealing with these challenges, the great part about this program and the other people who are on this call with you today is some other jurisdictions are working on this too, and some people may have figured out solutions that they're able to share with you. So just highlighting the expertise on the line as a key resources for all of you moving forward as well. So this chart provides a visual flow of the criminal justice system when it comes to access to diversion or alternatives, and really thinking through the subparts of the system that can lead different initiatives. And the exciting part about JMHCP is that some of you represent all of these stakeholders, from law enforcement, pretrial, courts, jails, pre-booking and post-booking opportunities for people with mental illness and co-occurring substance use disorders, as well as really thinking about how to connect to the community-based continuum of care. We're working with the grantees to really think about how responding to this through screening, assessment, identification, making sure people are receiving the right level of treatment and support services, as well as supervision if needed, and really trying to shift from one-off programs to thinking about how it's connected to other things that are going on in your jurisdiction to really create a better continuum of people with behavioral health needs. So this is one of the documents that's actually referenced in the solicitation. And we'll talk about through technical assistance, but it really asks the key questions on what is diversion, what does it look like, how will you work across the criminal justice system to do that? So really trying to take everyone from the individual program to the systems level thinking, and thinking about how to make those connections throughout your systems and throughout the multiple stakeholders within your jurisdiction who make up the criminal justice system, which is made up of more than one system. So it's really important when we're thinking about people with behavioral health needs of how do we address some key issues, which includes the criminal thinking and behavioral aspects, mental health and substance use disorders, and how do you actually do these in a combined way to think about how to reduce future justice system contact and help reduce recidivism as well. In order to address this, we developed a web-based tool about case management that really thinks through how to address criminogenic risk and need factors along with behavioral health needs, and focuses on who can help with the planning effort to really come together and make it happen from the community as well as from criminal justice partners. There's 10 key priorities that are outlined in this, and it should be a helpful resource for you. To share a little bit, one other thing. So Stepping Up is a national initiative to decrease the prevalence of serious mental illness in jails that started about 8 years ago. Since then, over 570 counties across the country and 45 states have joined Stepping Up as a commitment to the work. There are over 40 innovator counties leading in data collection and support for people with serious mental illnesses, some of whom are Justice and Mental Health Collaboration Program grantees as well. And there's a great focus in Stepping Up that's really on helping communities with people with mental illness and co-occurring substance use disorders to reduce jail populations, to create more crisis responses, diversion, and equitable access to services. So some of your counties may be Stepping Up counties, and that might be something to coordinate on your end as well, is really to get linked into that group who's already thinking about some of these system issues. And I am going to turn it over to Ernie, who's going to go through some of our law enforcement work.
All right. Well, again, good afternoon and a huge congratulations. I know Ms. Brooke already congratulated you, but this is something that you should really take the time and just take in, because this is a huge opportunity for you to make a difference in your community. The police mental health collaboration, this is a common framework for over 18,000 plus law enforcement agencies across the United States. And this is a resource that's intended to assist local leaders, including elected officials, law enforcement and behavioral health agency executives, and their senior personnel who want to begin or improve existing outcomes of their police mental health collaborations. So I can promise you this, there will probably be no problem that you come up across that we have not seen before. I'm going to brag on the staff for just a minute and go off script, because we have the absolute best staff here to help you be successful. So again, congratulations. And next slide. 6 questions here. The PMHC framework supports leadership to address key areas of focus by considering the following 6 questions: focused on leadership, protocols, training, resource and service coordination, data, and the quality assurance of improving performance. And if you look at these questions here, number 1 truly is leadership committed? Obviously they are. The grant process had to be approved by leadership to move forward, and that's what it takes. It takes true champions to be a part of these programs and make them be successful. Policies and procedures, that's going to be part of your planning and implementation guide that we're going to help you fill out. We'll help you with those policies and procedures if you need it. Training is kind of what we do here. That's our specialty. And we're going to continue to go through the process to help you be successful. We'll talk about how to collect and analyze data, because it's going to be probably some of the first time that you're going to collaborate with a behavioral health authority or agency organization, where you're going to have to figure out, how do we collect and share data? How does that work? And then how do we improve our performances? So we will ask these 6 questions in the planning phase and help you come up with the answers to that. Next slide. The law enforcement learning sites can be utilized to learn best practice approaches based on the needs of your communities. These learning sites have been strategically chosen by size, population, and resources. And I'm going to show you here in just a moment a map about where these learning sites are. But if you're not familiar with them, they are chosen best practice models based on the size of their community, the size of their organization, the size where they're geographically located. And they have proven to be robust and successful in partnering between law enforcement and behavioral health. So we're going to help. You don't have to go out and reinvent the wheel. We've got best practice models already that are doing this at a very high level, and we will be able to make those peer connections for you in case you need to have some one-on-one assistance from one of them to help you figure out how did they get started in a geographical area where it's very rural, or did they do a regional approach? So we're going to help you get connected with those learning sites as they have proven to be very effective. Next slide. On this slide here, you can see where exactly the learning sites are. So in 2010, we had 6 cohorts. And I'll tell you this, they are still all the learning sites here today. We haven't made any changes. We've added one here recently, as you can see at the bottom of this slide here, Denver. We are very blessed. I'm always going to give her a shout out anytime she's on the call, but Carly Salon came from Denver. She was the program manager of the Denver Star program over there, which made them very successful. So we've got the staff here, the learning sites, in order to help you make those peer connections. Just take a look at the map and see where you are located geographically. If any of these locations, if you're familiar with them, population size is one that you already have a picture interest that says, okay, I didn't know that. I did not know that Tucson, Arizona was a learning site. I want to be able to reach out to them if we have any questions moving forward. So we'll get into that a little bit more in the Connect and Protect breakout room, but I want you to know that we do have best practices available for you. All right, next slide. Oh, well, then I'm going to turn this over to Ms. Brooke here to give you an overview of the JMHCP grant program. Thank you.
Thanks, Ernie. The goal of JMHCP is to develop collaboration across the criminal justice and behavioral health systems, from law enforcement, pretrial, courts, jails, and community supervision. We want to learn how to have successful partnerships that increase efficiencies and improve public safety and outcomes for people with mental health conditions or co-occurring mental health and substance use disorders in the criminal justice system. There have been over 770 awardees from across the nation, representing 49 states and 2 U.S. territories, American Samoa and Guam. And we're excited to welcome the Northern Mariana Islands this year. We are proud to have worked around the country to support state and local programs. Nearly $218 million has been awarded through the JMHCP grant program to improve public safety and responses to people with behavioral health conditions and co-occurring substance use disorders in the justice system. We're excited to have an increase in funding for this year, enabling 65 grant awards. So as I just mentioned, this year there were a total of 65 new grantees, 33 awardees for Connect and Protect, and 32 for JMHCP. We have people working throughout the criminal justice system, law enforcement agencies, pretrial courts, jails, probation and parole, all in partnership with their community-based behavioral health providers. I will go over a bit about each grant track, but stay tuned for even more information during the grant track specific breakout sessions later in this meeting. So all awardees will work under a 2-phase process. The first is planning and the second is implementation. The planning phase is up to 12 months, and during this phase, you'll work with your TA coach to complete your respective purpose areas planning and implementation guide, which will be discussed in more detail later. Up to $100,000 can be used toward the planning phase for up to 12 months after budget approval. Once BJA and the TA coach has approved your P&I guide, then the implementation phase begins. The period of performance for all grantees is 36 months. Eligible program participants include preliminary qualified offenders as defined in legislation. As it relates to violent offenses, those who have oversight of the program has some authority when determining whether a person who has a violent offense can participate in a respective program. Specifically, it provides that a person is a preliminarily qualified offender if the offender has been unanimously approved for participation in a program by 1, the prosecuting attorney, 2, the defense attorney, 3, probation or corrections official, and 4, judge, and 5, the relevant mental health agency. Provided that those who can make approvals as enumerated above has determined that the person doesn't pose a risk of violence to any person in the program or the public, if selected to participate, they can in the program. In making that determination, the statute requires the following things be considered. In determining whether to designate a defendant as a preliminarily qualified offender, the relevant prosecuting attorney, defense attorney, probation, or corrections official, judge, and mental health or substance abuse agency representative shall take into account the following: whether the participation of the defendant in the program would pose a substantial risk to the community, the criminal history of the defendant and the nature and severity of the offense for which the defendant is charged, the views of any relevant victims in the offense, the extent to which the defendant would benefit from participation in the program, the extent to which the community would realize cost savings because the defendant's participation in the program, and whether the defendant satisfies the eligibility criteria for program participation unanimously. A person who has been charged with a convicted of any sex offense as defined in this title, or any offense related to the sexual exploitation of children or murder or assault with intent to commit murder, cannot participate in the program. Next slide, please. So the next 3 slides will outline the various program objectives for Connect and Protect grantees, which includes to design and implement a crisis response program based on current best practice, to assist law enforcement officers to improve encounters with individuals who have mental health disorders or co-occurring disorders, to plan and deliver a crisis response program through coordination between law enforcement and a behavioral health agency that includes services to improve or enhance the response, to pay salaries as well as other expenses such as training, overtime, coordination activities, and to design and implement a police mental health collaboration program, or PMHC. Next slide. To engage residents through outreach and education to improve public health and public safety, to build positive community relations, and to enhance officer knowledge and skills in responding to community members with behavioral health disorders or co-occurring disorders. Next slide. And finally, to increase public safety and public health agencies' capacity to develop and sustain the program by collecting data, develop policy, create stakeholder groups, and encourage ongoing professional development, as well as seek guidance through BJA's 14 law enforcement and mental health learning sites, and then incorporate and build upon successful strategies for PMHCs. Next slide. So the next 3 slides outline the various program objectives specifically for the JMHCP program grantees, which includes to enhance, expand, and operate mental health drop-off crisis stabilization treatment centers and provide 24/7 support for law enforcement, criminal justice agencies, and people who come into contact with the criminal justice systems. And these centers can provide the following services, but not limited to such: screening and assessment, crisis care, residential treatment, assisted outpatient mental health treatment, primary healthcare services, telehealth, competency restoration, community transition, and other supports such as connecting to housing. The objectives also include to increase the community's workforce capacity for certified mental health peer support specialists and increase the availability of wraparound services. Also to build or expand capacity to identify, treat, and support the recovery of individuals at the intersect of justice and mental health. And finally, to build or expand existing justice and mental health collaboration programs across people and places at any point in the criminal justice system. And to also include targeting individuals with mental health disorders, including traumatic brain injuries, PTSD, or mental health and substance use disorders at risk for recidivism. Next slide. And so with that, I will turn things back over to Sarah to facilitate the questions and answers and guide us through the grantee-specific breakout portion.
Thanks so much, Brooke. So if you all have any immediate questions that come up, please feel free to put them in the chat. We have one already, but we haven't gotten a lot of other questions, which is totally okay. So the first question is, how many applications were submitted for the Connect and Protect grant program? Brooke, I'm not sure if you actually have that information at your fingertips or not, but we can try to answer it if you do.
I actually don't have it available to me, but I will be sure to report back so that this question is answered next week at part 2.
Awesome. Thanks so much. So typically during these, we get a lot of questions on getting budget approval and budget clearance. So just wanted to say to everyone that those are great questions to bring to part 2, which will include the programs office. So if you have questions about your budget, how to accept awards and things along those lines, definitely good for the webinar next week. So bring those questions there. Another question we received was about TA coaches and when will you be hearing from your TA coaches? And that will be actually in the next couple of weeks. So we're working on finalizing your TA coach assignments. Within the next few weeks, they will reach out to you and work to schedule a call that will be in December. And then you'll get to work with them monthly. They will also be able to share the planning and implementation guides, which we'll talk more about in the next breakout sessions with you as part of the process for scheduling those calls and really go through that with you. So I'm going to give space in case anyone has any other questions. Okay, so it's never too late to ask. We're going to go into some breakout groups. You can ask questions there. You can also always email any of us. We'll have all of the contact information available too. You can go to the next slide. So now we're going to go into the breakout. So the easiest way to do this is for the JMHCP grantees to stay in this room and for Connect and Protect grantees to move to a breakout room. So it says join breakout rooms at the bottom of your screen. And if you're one of the Connect and Protect grantees, you'll click to join that. And Ernie and Allison will be over there with you to facilitate and have that discussion with you. And if you're not sure, you can look at the list. And if you're on this list, you go to the other room. If you're not on this list, you stay with myself and Brooke in this room. Oh, okay. And I do see another question now. That was, we included a consultant to help with the planning process. So how does that work in conjunction with the assigned TA coach? So I think that's really up to you in terms of what works best for you, but you can certainly bring them to the planning calls to help support it. But your TA coach is also there to support you through the planning process and completion. So we can talk to you more about that on the call as well.
Sarah, before we hop over, I was a little ambitious and wanted to get a response before the next webinar. So with respect to the number of applicants for Connect and Protect for FY23, we had a total of 81 applications submitted.
Wow, awesome. Thank you so much.
No problem.
Okay, so if you're Connect and Protect, move to the breakout room. And then I think on our end, Andrea, can you bring up the slides for the JMHCP breakout? And everyone, you will be with Brooke and myself for this. So stay right here, please. Okay, so we're just going to talk a little bit about the training and technical assistance.
Pardon me, Sarah. I'm sorry to interrupt. This is Allison, but I'm not seeing a way to get over to the breakout for Connect and Protect.
So if you go to where it says more at the bottom of the screen and it says breakout rooms, you click join.
Ah, thank you.
You're welcome. Also, Andrea can put you in the breakout as well, I think. Okay, Andrea, we can see can you bring it up to full screen? Thank you. You can go to the next slide. So really this breakout is meant to talk about training and technical assistance opportunities. We're so excited to work with all of you, and some of you we have worked with in the past. So definitely excited to learn what worked for you previously in training and technical assistance, or what you'd like to see different moving forward. We'll also have time for questions. Feel free to continue to ask questions like in the chat. Brooke and I can answer as we go. This does not have to be super formal. This is also an opportunity for you to get to know a little bit more about the fellow grantees. So for JMHCP, there's 32 total awards. So in addition to yourself, 31 other sites doing really cool things. So you can just start to get to know what other people are doing and think of sites that you might be interested in talking to at a later date too. We'll have questions and answers, and then some resources that can help you as well. Next slide, please. So we're going to actually go through all of the new awardees. And so because there is so many of 32, we're not going to ask you each to do an individual introduction verbally, because that can be a little tough in this format. But what we will ask you to is introduce yourself in the chat. So as we go through, can you say who you are and who you brought to the webinar? So the first one is Alta Health Systems in Alabama, and working on a co-response team and some telehealth issues. And the grant focus is really just supposed to be a succinct summary, and it may not include everything your program is doing. So if anyone from the Alta Point team is on the line, please introduce yourself in the chat. Bristol County Sheriff's Office in Massachusetts, who's focused on programming within their jail. We have City of Gresham, Oregon, who's working with peer specialists as part of their program. The City of Methuen Police Department in Massachusetts, and I apologize in advance if I totally butchered that. We'll learn how to say that hopefully better. Who's doing a community response team and a community support center. The City of Las Vegas, North Las Vegas, Nevada, who's doing court diversion. City of Santa Monica, also doing court diversion. And City of Tuscaloosa, also doing court diversion. Next slide. We have the Commonwealth of Northern Mariana Islands Judicial Branch, who's also doing court diversion and mental health court. The County of Benton, Arkansas, doing court diversion. County of Du Bois, Indiana, doing co-response. The County of Rockingham, Virginia, doing co-response and support services. The County of Washington, doing court diversion. Cumberland County, New Jersey, doing court diversion and jail reentry. Douglas County, New Hampshire, Nebraska, doing court diversion and support services. Remember, you can definitely introduce yourselves in the chat if you want to, as we are going here. Oh, thank you, Abby. For jumping in, Essex County, Massachusetts, doing court diversion. Hancock County, Adams Board in Ohio, doing a diversion center. Judiciary courts in the Commonwealth of Kentucky, doing court diversion. Judiciary courts of state of Arizona, doing court diversion and mental health courts as well. We've got Lamoille County Mental Health Services in Vermont, co-response and specialist, and sorry if my pronunciation is off for some of these, doing the best I can. The Massachusetts Supreme Court, which is actually Franklin County's Massachusetts jail. Marion County Sheriff in Indiana, it's also doing a jail program. Thank you to everyone for introducing yourself. Excited to have you all here, and some familiar faces amongst that group as well. Excited to be working with you again. Muskegon County, Michigan, working on their jail. New Hampshire Judicial Branch, mental health court coordination. Seminole County, Florida, court diversion. Unified Court Systems of New York with the Bronx Criminal Court. The New York also has another one with Rochester Surviving and Finding Empowerment or SAFE Court. University of Massachusetts doing system mapping and data evaluation. Utah Department of Health and Human Services focused on jail reentry. Valley Community Board Services working on a crisis stabilization unit. Van Buren County offices in Michigan, court diversion. Washington State Department of Corrections focused on some jails work, and Washoe County, Nevada on court diversion. So welcome to everyone. Excited to see you all here. Thank you to everyone for introducing yourselves in the chat. We're looking forward to working with you and having opportunities for you all to connect more too. So I'm going to talk a little bit about training and technical assistance. Some of you might have had this as a requirement for other types of awards, but we'll tell you a little bit about the CSG Justice Center approach to TTA. So we have really 4 big pieces of training and technical assistance. And really it's talking about, you have your TA coach, there's access to subject matter experts, there's peer learning, and then resources and tools. So those are kind of the 4 big cornerstones of our TTA. And the TA provider, or you'll hear it called a TA coach, is really the air traffic controller of our training and technical assistance processes. And they're going to be your main point of contact, and they will be holding the monthly calls with you. They will work through the planning and implementation guide with you. They'll help you in developing training and technical assistance plans. They'll provide you with resources. They can help with some of the peer learning and peer connections. We also will have communities of practice, which is a smaller cohort opportunity to connect with other folks in your cohort and from other JMHCP or Connect and Protect cohorts as well. And then for some cases, we're also able to do site visits where we can come on support in person to do some type of training or to really support stakeholder engagement or different key issues that you may be encountering. We're not able to do site visits for everyone, but exciting when we are able to do those. Next slide. So a big focus for you all in the first year of this grant is the planning and implementation guide. So we just wanted to lay out a little bit about what those are and what they look like. So there are 7 different sections in the guide. And the first piece is really talking about your goals and thinking through, since the application of the grant, which is, was months ago at this point, and sometimes there's been changes since then. So really thinking about, are there any changes that would impact your grant program at this point? Do the goals that you originally wrote in the grant program still resonate with your team and for the people who are actually implementing the program? So really thinking about going from conceptualization of this exciting program to how do you actually get to implement, which is why the planning and implementation guide was developed in the first place. So the second section is focused on collaborative partnerships. And we like to think about this in 2 ways. There's the advisory work group who helps oversee it. So that's criminal justice and behavioral health stakeholders. Often decision makers are included in those. So for different court programs, it might be judges and prosecutors and defense attorneys. It might be someone from homeless services, other partners that you can think that would be helpful in making these decisions, including your behavioral health and justice system partners. There's then also an implementation team. So those are the people who are really doing the day-to-day work to help implement your program. And so we like to think about those two different groups. What do you need to have to talk to the larger stakeholders and really get buy-in and get referrals to your program? And then what do you need to do, like a screening tool, an assessment? How do you actually get people into the program that the implementation team would tackle? The third section is on target population. So how do you know who you want to serve? How many people you think you'll be able to serve? How did you get to those numbers? What does that look like? How can you make sure you have access to the people who most need services based upon their mental health needs, co-occurring substance use, and often their criminogenic risk factors as well that may come into play in making decisions for this. The fourth section is about the services and supports you provide. So this could be an evidence-based practice that you might have that you're planning to provide. So let's say seeking safety. It could be something like we're doing intensive case management and wraparound services. We also have referrals to housing. You might have transportation as a part of the support services and other things. So it's really laying out what types of things can your program provide or referrals that might be needed to really think about how to make the person most successful within the community. It also gets into information like Medicaid enrollment and insurance coverage. So how can you actually pay for those services in addition to the grant funds too? And there is a section on housing. So housing tends to be one of those big, hairy, scary topics that we're hearing about from every site. And so there's a section that goes through thinking about and identifying housing partners that you can use for this. The fifth section is on data collection, performance measurement, and program evaluation. So just as it sounds, what are the key metrics you need to do? How are you measuring it? What's your measurement for recidivism and the things that you have to track for Department of Justice, but also the metrics that you want to track for your stakeholders and for the long-term sustainability of your program. If you have an evaluation partner, this is the point in which it would ask who's that partner is and, thinking about developing some type of plan for that as well. Then we talk about sustainability. So from day one, it's helpful to start thinking about sustaining the program because you have this awesome opportunity for this multiple years of funding through the federal government. But, that will come to an end at a certain point, and thinking through, are there state options? Are there other opportunities you can leverage, or figuring out ways to better leverage Medicaid to pay for some of your services to really get long-term continuation of these services that you're going to work so hard to develop or expand. And then the last section is just getting towards thinking about a technical assistance plan. So the first part in the planning phase is really focused on the planning and implementation guide. And then the second part will really work with you to develop individualized goals where your training and technical assistance coaches can support you to reach. So that section will be moving towards thinking about a TA plan that we can work with. So you all know what we're trying to achieve with you, and we can work together on those. Next slide. Andrea, there's like a message that's in the middle of the screen. Thank you. I was just noticing it. So once we move to implementation, as I said, there will be a TA plan developed. So that will be something that will actually be shared with you. It'll be written down. There's typically multiple goals that you'll lay out, and that can be continuously reviewed and updated. So the nice part about it is the TA support is here for the life of the grant. So for multiple years, you get to work with us and we can support you. So there's going to be initial goals that are developed, and we hope you'll reach those goals and we can iterate and find some new goals of how we can best support you. That could also include, like, I really want to connect with some peer organizations, other organizations doing things that are similar to me, and things along those lines. It could be, I want to work on an evaluation plan or how to get a research partner. It could be related to refining your screening process. So tons of options there that we can work with you. And through the planning process, some of those things may come up. You may think, I really thought I had case management figured out, but I realized there's more stakeholders I'd love to engage on that topic to make sure it's a little more seamless in terms of connections with partners. So after the planning phase, the TA plan will really be the roadmap for what we'll work on together. And then we also have communities of practice. And so communities of practice are smaller group opportunities to work on specific issues. So one of them is data collection and evaluation. And that's with Dr. Faye Taxman, who works at George Mason University and runs the Center for Advancing Correctional Excellence. And she really helps us think through different data challenges. So it's really an opportunity to have access to an expert and to think through some data and evaluation pieces that you might be grappling with, and also to get to know some other grantee sites better. So these are all an opportunity to communicate with fewer sites and get to know some other program leaders in different states, jurisdictions as well. Some other communities of practices are related to stepping up and zero returns to homelessness. So thinking about how to decrease homelessness for people who are involved in the justice system and, returning to the community or cycling through the jail and community, as sometimes happens, unfortunately. So another resource for you is the CSG Justice Center newsletter. There's like always a webinar or something going on. So we just encourage you to sign up. Your TA coach can also direct you to things that are most interest to you as you get set up for these grants. Next slide. Any questions before we wrap up? Or I will ask you, if you can use the hand raise function, how many of you have actually worked with the CSG Justice Center as a TA coach in the past? So we have a couple. I'm seeing 2 hands raised and another one in the chat. Any suggestions that any of you have in how to, get the most out of training and technical assistance opportunities that you can share with your colleagues who may be new to this process?
Hi, everybody. I'm Abby Carbine with Douglas County, Nebraska. I think the meetings like this and just some of the opportunities that we have that we've had to be able to network with people who are doing similar work or who are in the same boat as us, to really ask questions and leverage what has worked and what hasn't worked. We've learned a lot by not having to reinvent the wheel. And we've also done a lot in our previous project of documenting what we've done so that if somebody comes to us and asks, we can say, here's what has worked really, really well for us. Here's what we would advise not doing. Here's what we've tried. And you might be able to go either way with it. So I think just the opportunities to be able to connect with people who are doing the same work that we otherwise wouldn't have access to or are working on similar projects.
Thanks, Abby. If anyone else has thoughts to just open it to others to share as well.
I would just say, I'm from Hancock County, Ohio. We've had wonderful technical assistance. And I think one of the things that's been really good for us is that disciplined time every single month just to sit down and talk about a project, because life gets busy, people get busy, and just having that specific time set aside is very helpful.
Yeah, such an important point. I know a lot of you wear 10 to 20 hats often in your jurisdiction. So it's like having the ability to just talk about one thing can be super helpful for sure. Anyone else who wants to share? I'm also seeing there's a question in the chat that I totally missed. So apologies on that. Apparently I'm not that good at reading the chat as I'm talking. You're asking, is there a template for the planning and implementation guide? There is a template and we just updated it for this year. And so we're going to wait for your TA coach to provide that for you, and you can talk about it on your first TA call. But if those of you have been through the process in the past, it kind of covers the different things that I already discussed as like part of it in a broad overview, but you'll get that from your TA coach when they're scheduling the first call. So they'll provide you with the updated guide. So there's a template, you don't have to invent the wheel. So that hopefully is an easier lift than trying to do that. And the first call will be in December. So that will be the first monthly call. The TA coach is going to reach out to you within the next couple of weeks. So by the end of November. So you'll have the opportunity to talk to them soon. And in the meantime, if you have questions, you can reach out to us as well. We'll have our contact information. So there are different TA coaches, actually. This is a good question. It's saying, will the TA talk to everyone or only the one person contact? So the expectations of the TA calls is actually for you to bring mental health and justice partners to that. So just modeling the JMHCP grant requirement, we really expect, you know, multiple people to be on the call, and people do it differently. But you know, we talked about that advisory group versus the implementation team. And in some cases, we may talk to the advisory group 1 month and then an implementation team the other month, but it really depends on what works with you. But I think at a simple level, having the justice and mental health and behavioral health partners on the call is, you know, the minimum there. But often as you move to implementation, it ends up being more focused on the implementation team to really address challenges. Maybe you're not getting the same amount of referrals you expected. You're having trouble screening people and identifying people for services, things along those lines. So we'll usually be more than one person. Hopefully the main grant point of contact would be one of those people that would be on the line as well. So it's meant to be a resource to the team, not just one person, ideally. Okay, other questions? You can also feel free to unmute yourself and ask questions. Or if anyone had anything else they wanted to share too.
Hi, this is Jenna from the city of Santa Monica. We have, like you said, been doing this process for a long time now. And so we feel like we are at the point where we could possibly start running a pilot program. And our courts have given us the option to do that and have given us a date. Is that problematic, or should we reach out to your folks or to whoever's going to be our TA to kind of work through a planning and implementation phase, just since, again, we feel like we've been planning for the last 8 months?
Well, that's an exciting position to be in, that you guys have continued to dedicate staff time for this. So that is awesome to hear. I can tell you some of the experience we have from working with sites previously, and then I'll look to Brooke to really think through this as well. But it is possible potentially to do pilots during a planning phase process. Regardless, you still have to work through the process of developing the planning and implementation guide. If you're piloting during that time, it may give you the opportunity to troubleshoot some of the screening assessment processes, some of the referrals and things like that, which can help you in moving to implementation. I think the one thing to note is that during the planning phase, there's a specific amount of funds that you can use. So Brooke, I think maybe you can speak to that a little bit more.
Yeah, certainly. So just keep in mind, Jenna, that because there's only $100,000 of the overall award that can be used during the planning phase, that might have an impact on the pilot based on staffing and resources that are needed. Now, once that planning phase has been approved and the rest of the funds are released, ultimately you would be good to go. In terms of timing, that could certainly be something asked during part 2 of the webinar. Since our budget and finance people will be there, they may be able to give you a better idea. In a perfect world, if you were able to get everything done and submitted and approved as quickly as possible, when would the rest of the funds be available?
Thank you.
No problem.
I will also say that the planning and implementation guide does take time, so I wouldn't expect to like complete it in a month and then have it approved. So I know some people who might be new, you're excited, we're excited for you, and we work as best as we can with you to get it done on a schedule that works for your team. But the whole goal of it is to make sure when you move to implementation, it will be seamless. And there are multiple sections. So I wouldn't expect that you can just do it in like a month time frame, for example. So just want to make sure to level set those expectations when you're thinking about this. Okay, so Jennifer in the chat says we have a project manager as part of our grant. Can we start prior the planning and implementation guide is approved? We're small and need individual help. So I think that goes to a little bit to the question before. So I think it is common for people to hire project managers or coordinators during the planning process. The only caveat would be, depending on how long it takes, you have up to $100,000 in funds. So you could be using those funds to pay for a project manager. I'm seeing Brooke's head nodding, so it's like that was there.
Yeah, sorry, absolutely.
So yes, you can and should, especially if you're a small team. If you can hire, go for it. Get yourself the help you need. Yes, you should.
Oh, sorry, Sarah. So yeah, Jennifer, once the budget is approved and it's accepted on your end and then released, then you would be able to start drawing the money down.
Other questions we can answer?
Okay, I think I'm just going to unmute. This is Jennifer. So I
Hi,
guess
Jennifer.
we're super excited about this grant, but we are a small rural community and we do need our project manager to help. So I'm not totally following about the money to pay that individual. So we can't have money to pay that person until we get the budget approved. Is that correct?
Yeah, so the specifics regarding when the funds become available can only be answered by our budget office. They will be on with you next Wednesday to provide more specifics on a timeline for that. However, as soon as that's approved, the first $100,000 of the award does become available specifically for that planning phase. So you would be able to utilize the project manager and pay them to assist in that process.
Okay, so then the budget could be separate from the planning and implementation guide. Is that correct?
So the budget of the project kind of like gets dispersed in 2 phases based on the planning and implementation guide. So grantees have up until 12 months to complete the planning phase. And within that time, $100,000 of the award is released. As soon as that planning phase is complete and approved by budget, then the rest of the funds gets released. So it's really just contingent upon whenever the planning portion is completed and approved.
Okay, thank you.
No problem. Did that clarify?
I think so. I think we probably really can't hire this person to help like with the planning and implementation because that has to be completed prior to us. getting money to pay this person. So
Okay, yeah, and just getting a better sense of when that date will be. I would definitely make sure you jot down that question for next Wednesday, and our programs office will be able to give you a better answer.
perfect. Thank you.
No problem. I see another question from Bridget pertaining to budget. So I would definitely let you know that that is another question that would need to be asked by the programs office next Wednesday. Unfortunately, I'm unable to answer that, but the question is regarding amendment of budget.
Any other questions that people have? I know a lot of it's complicated and can be overwhelming when you receive new funds, so we're here to answer them.
Just one more quick one. So we also consult out with someone and we can invite them to be on this Zoom call next Wednesday too, correct? Like we can invite other people to be on here with us?
Yes, you can invite other people to be on the call with you. It's really up to you who you think needs to be. The second webinar is really focused on grants management, budget oversight of the Department of Justice, Bureau of Justice Systems Programs Office, as well as the performance measurement tool. So if someone's helping you with like that data side of things, it might be helpful to invite them to the call as well, if they're helping you kind of on that side, because those are the questions that you'll answer and submit quarterly that help you stay in good standing for your grant as well. Okay, so I'm going to start going through some of the additional slides, but if you have questions, feel free to unmute or put them in the chat. We can still get to them for you. Next slide. So I mentioned the part 2, so it's next Wednesday, November 15th, from 2 to 3 p.m. And your upcoming TA call will be in December. So like we'll work to schedule those with you in December. So the TA coach will reach out to you by the end of November for those, and then work to try to schedule it before the end of the year. So just some resources. These are things we discussed in the beginning part of the webinar, but there are some resources that could be helpful thinking about case management and case plans to address criminogenic risk and behavioral health needs, and thinking through some diversion opportunities and really taking a look at the system rather than just individual program development. Next slide. And here's our contact information. So the great thing about this is we continue to be a resource for you for years to come. So reach out with any questions you have. We're happy to answer them. And if we can't answer them, we'll direct you to someone who can. So that is the good part about all of this. So please see us as a resource. You can contact myself or Brooke. We're happy to answer. And then your TA coach will be the easy point of contact once you hear from them as well. Just going to pause here again to see if there were any other questions that came up. The time next week. The time next week is on the 15th, I believe, at 2 p.m. Let me double check if that is not correct.
It is, yeah. It's next Wednesday from 2 to 3 p.m. Eastern Standard Time.
And so the link for that we can paste in the chat as well, just so you have it again, but looking forward to talking to you then. Congratulations on these awards. We are very excited to work with you. Please reach out with any questions. Thank you to Brooke for all of your support on this webinar. And we look forward to talking to you next week as well. Please let us know if you have any questions, and have a great afternoon.
Thank
Thanks so
you,
much.
everyone. We're very excited to work with you. Have a great one.